Hi there, Gina here. I'm a speech therapist and I really want to help you with something important today. Biting. This is something that so many parents really deal with and struggle with. It is a challenge. It is not fun. It is no fun to get the call from the school that your child bit someone, that your child bit themselves. It's just not something fun to deal with, but I want you to know that you're not alone. And there are things that you can do, and we can try to help you figure out even maybe why this is happening. So, first, I want you to know biting is really common. Yes, I promise you, I know not every kid at school has told you that they bite or that their parents have told you that they bite, but it's really, really common, especially for boys. So, when are you going to see biting across the board between boys and girls? Most likely between the ages of 1 to 2. So, there's a couple reasons for this time frame. I want you to really think about your child and the fact that they're teething. Children during this time frame have tons of teeth coming up every day. It can be really painful and frustrating. They may not know how to explain that it hurts, and they just want your attention. They really kind of feel a little bit needy more, and they just, when they're teething, I know my son's really clingy when he starts teething, his teeth coming up left and right. So it's really hard for them, and biting can actually feel good and it gets your attention. So that is really common, is teething. Something else they start doing, which is super common too, is they bite objects. So they start to explore new objects, and along with this, that biting thing, it's just something really natural for them. So first thing they're going to do is they're going to touch it with their hands, bring it close to their face and see it, and they're going to put it in their mouth. And it's a way to explore. So if you think about the fact that yes, you've been around them this whole time, but everything may be different from a new perspective now. Your hands may look different if mom just painted her nails or has a ring on or a watch or some kind of jewelry. And they want to explore it, they're going to go straight to their mouth. And then they may bite you afterwards if they want your attention still. So that's really common. A great way for them to learn and explore new things. So also between 1 to 2, a lot of mamas take a year off and then they go back to work. So they may be around a lot of other children at this time, whether it be school or preschool prep programs, mommy play dates, mom's day outs. They're around other children around this time. Even just the fact that once they hit past 6 months old, a lot of moms are more inclined to bring them around other children because they're not susceptible to dangerous germs and picking up really bad, dangerous things. Their immune system's stronger and they're stronger. So play dates are more common. So they see other kids do this. So think of that monkey see, monkey do. That's exactly what we're talking about here. If they see another child bite and they think it's normal and natural, maybe they didn't see a consequence or anything after it was done, and then they think, okay, biting, that's something that we do. Our children learn to walk and crawl. They try new foods because we've tried new foods. So it's only natural for them to also bite if they see another child bite. So very, very common. So there is a cause and effect relationship here too. They're learning cause and effect at this time, so they're going to do something to see what the response is. So I want you to think about any time that you've been bit, not by a child necessarily, but by a mosquito or a dog, an animal, anything that has bit you. I want you to think how you reacted. Okay, so for me, if I'm bit by some kind of animal or something, I'm going to say, ow! My eyes are going to get big. My face is going to get all expressive. I'm going to look at it and take my attention from wherever it was and direct it right to whatever bit me. So when it's your child, your response may be similar or even worse. So let me explain worse. Worse is the fact that it's your child. Maybe it didn't hurt that bad, and you're going to look at your child and you're going to smile because it's your child. You may even laugh or giggle. So if your child bites you and you look at them and you say, oh, no, 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 I didn't want you to bite me, and you giggle and you laugh and you give them face-to-face time and really great communication and interaction and attention that they desire and crave, especially while they're learning language and communicating skills, they're going to do it again. They're going to make it the biting game. And they're going to love the fact that you actually gave them attention, and now they feel like it's kind of fun to bite you because they know that you're probably going to giggle and smile and laugh and get right up in their face. So they're actually really going to like biting you. Other reasons children can bite are for attention or to express wants and needs if they're frustrated. So just communicating if they're fearful, angry, sad, or frustrated, they may bite you. The big reason and primary reason that I found to be associated with biting, though, is language development. So not necessarily a delay, but during 1 to 2 years old, all children's language develops at a different rate. So even your late talkers, they're learning to express their wants and needs, which is really important and a really imperative, just crazy time in your child's life. Their language is just rapidly going from here all the way up to here. But they may understand some words and not be able to actually tell you what those words are yet. So I want you to think of the fact, if your child wants a glass of milk and you're in the kitchen, but they may know what milk is, and if you hold it up, they can point and reach and grab for it. They may even make an approximation when they see it, because very visually they've been able to see it. So they may say, mama, 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 and you'll give them milk. But if they're in the kitchen and they just know what they want, but they don't know how to tell you, it's so frustrating for them. They may bite you. So that's a really good way to explain the frustration of not being able to say wants and needs. And for me to try to give you a better visual idea of why communication is so important for your child. So I have found across the board, as children learn language and can learn to express what they want and tell you what they need, they are happier and the biting just decreases significantly. So if you feel like your child is biting a lot, other children, other people, and just all the time, and it's just so frustrating for you, I definitely recommend you go to your doctors. There's nothing wrong with going to your doctor and saying, hey, we're biting, we're at school, we're biting, it's happening, I'm frustrated, I want help. So your doctor may be able to tell you if your child's speech and language are developing at a rate that he would hope, or maybe not so far behind, but then maybe he thinks you can benefit from a speech and language consult. Now, I know that sounds frustrating for me. I swear anytime that like the doctor, the vet, or anybody's just like, hey, the dog needs to go to the dentist again, or it's almost, my head just rings this bell like, of course I want to help my dogs. I want to help my child. But I'm so frustrated over the fact that I have so many things to do, and it's just another little thing that now is going to take away from either my time that I need to get things done, or my precious time of just enjoying my child and being with my child. So I want to explain to you how simple speech and language therapy can actually be now for you. I know it sounds crazy, but a doctor can recommend a consult. So you do have to go to the doctors to get a recommendation. But once that's done, there are so many different agencies now that if you're a stay-at-home mama, or you're home more often, part-time, full-time, whatever, they can come to your house during the day and actually do therapy with your child. Some of them will even come after 5 o'clock. So it just depends who you're working with, but they'll come to your home. So if you are one of those mamas with your child at a mom's day out or a daycare or preschool, they will also go there, which is really amazing because that means your child can get what they want and need, build their skills with speech and language therapy and development and early intervention time from birth to 3 in their environment where they're already there, and it's not taking away from your time with your child or making so that you just have one more thing you have to do at the end of the day to get them to a private practice. So if you do want to go to private practice though, and that's something you're more comfortable with, you find enjoyment in learning from them and being involved in the process, you can also do that. There are so many different options. I highly recommend it. I have worked across many different settings, and I feel like this is such a great benefit to these families, especially at that early intervention, birth to 3 age. Take advantage of these services. Your insurance should cover them, so it shouldn't be anything that you're even paying out of pocket. So definitely feel like you should check this out and talk to your doctor. Now, if you don't feel like it's quite necessary for you to go to the doctors at this time, that's okay. There are some things that we can do. So as we talked about earlier, we talked about that cause and effect, which is really important for you to kind of just drill into your brain. Cause and effect, I don't want to play the biting game. That's frustrating. So think about when your child bites you or when your child bites someone else. I want you to think preventatively how you can help to make the situation better. What you need to do is you need to be calm and consistent, and you need to be firm. These are really important things to do. So I'm going to give you an example. When your child bites, says, "Oh no, mommy did not like that. That hurt. I didn't like it. No, no." So you can use phrases like, "No, no, I did not like that. Ouch, that hurt." Use those kind of things that are natural for you to say. Pick a phrase that your husband, your spouse, your family members can also use when this behavior comes across, and ask them to please be firm and calm. Do not laugh. Do not giggle. Also use visuals as well as hands and verbal. So you want to use your words. Also shake your head no. I'm not recommending using sign or things like that, but I'm recommending that you pair those cues, those visual cues and the verbal cues for your child. No, no, I did not like that. At this age, your child may not understand what hurt is. So when they do this, I want you to not necessarily pick up your child and soothe them right away. I want you to take care of yourself. So what I mean by this is go wash off your wound as if it were a terrible, awful bite and it was bleeding everywhere. What you do, clean it and get a Band-Aid and put it on it and show them, ouch, you hurt mommy. I didn't like that. The reason you're doing this is think about your child, what happens when they fall and hurt themselves. 99% of the time we get out those Band-Aids just to provide that visualization that someone has been hurt. They know what it's like when they got hurt, and they can understand that they didn't like it, it hurt, and they got a Band-Aid. So mommy's getting a Band-Aid for her owie, for her boo-boo, whatever you call it. Be consistent. Get a Band-Aid. I know it sounds so silly, but they will be able to change that mentality in their mind and click on that hurt. It did hurt. I did not like it. And you can do the same for whoever gets bit. I want you to really pay close attention and redirect your attention to that person that has been bit and get them a Band-Aid. Same thing. Get them a Band-Aid, try to keep them calm and comfort them. Now, this may actually upset your child for the fact that they have hurt someone when they understand, and when they do, that's a good thing. Don't feel like that's a bad thing. Now, I've hurt my child's feelings. No. Once you sit them on your lap and say, I don't like that mommy had to talk with you that way, but you should not bite. It did hurt. Mommy will get better. And I want you to say, I didn't like it. I would love for you to apologize and say sorry. So whether it's to you or to someone else, I want you to have them apologize. They may cry and they may sniffle. And when they do that, I want you to praise them. That was great for you for apologizing for biting. So you need to remember to tell them why they apologized. Repeat it for them. I love that you apologized for biting. As they get older, they can say, I am sorry I bit you. And you can repeat it again so that they just hear it repetitively. Oh my goodness, I bit someone. I hate that I did that. I don't like that I did that. And I'm sorry. So they can kind of understand those feelings and then move forward. I want you to redirect the attention to something good and something positive after that, so that they know that it's not the whole day is not over now. You bit someone, we can move forward though. So that's really important. I want to talk to you about prevention. I know if you know your child, once you start to understand this is a pattern and you know there are certain things like a certain toy that may trigger them, or a certain child maybe, if they just don't seem to get along and they don't want to be around, they're biting them, a certain person, I want you to not necessarily remove those things, because they may be things that they come and play with later that you can't control. I want you to put them further away. And I want you to put out things that are going to be more likely to redirect your child's attention to them. So maybe a preferred toy or a preferred activity, a favorite person that they would like to sit with. They can sit in your lap and you can try to redirect them. So the biggest thing though, is I want you to teach them words. So as we talked about earlier, speech and language development, as they develop and grow, biting will decrease. So the best thing you can do is find out what they don't like, why they're biting, and give them words to explain. So if it's they want food, I want, please, want, please, food, need food, toys. Yes, these are really general words, and I don't want you to side with them, because then they may stop talking and they will just kind of keep that overgeneralized word. But when they do get that, they've said, I want food or I want a toy. So then I want you to pull out a few of them. Pick it up. Maybe you have bear toy, car toy, and ball toy. Which one? Bear, car, or ball? Which one? And then you can let them pick. They've told you, I want a toy. Which one of these toys? You give them some options, and then they point to that one. Say, oh, you wanted the bear? Okay, bear. Here's the bear. Have fun and play. Now, if they're biting because of something they don't like that's doing, you can teach them to use things like no or I don't like it. You can teach them to use the same exact words that you're using with them. So teach them no, or stop, please. Those are really important things, especially for children that are more towards the, I don't want to say nonverbal because not nonverbal, but just children that have very few words. You're late talkers and their language just isn't quite there yet, which is fine. We're working on it. Really try to give them those words. So you can give them to them. You can practice behaviors with stuffed animals or toys. Maybe if they don't like when you poke, you can have a bear come up, the little bear or doggy stuffed animal, and poke them with it, and they can say, no, stop please. And you can say, oh, sorry, from the bear. Make the bear say sorry, and then sit the bear down. Say, doesn't like it, no. So that they can learn desired behaviors and what they want. These are really, really important things. Now, when should you definitely go to the doctor for biting? The biting behavior should stop and slow, or at least slow down between 3 to 4 years old. So if you're still seeing biting, especially excessive biting, just tons and tons of biting, definitely talk to your doctor. 3 to 4 years old and your children are biting a lot, you need to talk to the doctor and figure out what is the underlying reason and why this is happening. There are so many things that you can do, so you definitely want to just take advantage of your resources. If you have questions and comments down below, I have talked about so many things. I really want you to ask questions. If you have not subscribed, please subscribe. Ring the bell for notifications. I put up new videos every single week, and I want you to make sure that you're tuning in to see if any of these issues can be relevant or help you with your children. So let me know if there's anything you ever want me to talk about. I am happy to make a video specifically for you. So just let me know, and I hope you guys enjoyed this. Bye.